Mic check. All right. Good morning, good afternoon, good evening. This is Dr. Garais, BIO104, Anatomy and Physiology 2. And this is the Reproductive Systems lecture. We started it last week, and we may not have time because of the presentations. So I'm making this video. So the reproductive systems. Gonads are the producers of either sperm or the single ovum or egg in female anatomy. So ovaries, you have two of them, in females, and gonads in males are your testes. So the testes, via the hormone testosterone, will make sperm, and the ovaries via estrogen, progesterone, follicle stimulating hormone, and luteinizing hormone will, during the midpoint of the menstrual cycle, will release a single egg or ovum. And testes and ovaries are your gonads. Meiosis versus mitosis. Meiosis is the production of sperm or either egg, and there you could see two divisions, and there is mixing of genetic material. So in meiosis, just like mitosis, you start off with 46 chromosomes, a complete set, also known as 2N or diploid. But in meiosis, you end up with either 4 sperm cells or 4 egg cells or ova, and each one of the sperm cells and egg cells are only 23 chromosomes or 1N, also known as haploid. But mitosis, that is somatic division, meaning to say is soma, body. So if you have a skin cell, you start off with 46 chromosomes in mitosis, and then you'll end up with 2 skin cells that have 46 chromosomes each. If you start off with a heart cell, you should end up with 2 daughter cells or 2 identical cells. Hence, you'll hear the term somatic division or mitosis, right? So know these two. Sperm, we already talked about that. And here's a little bit of the anatomy of the sperm here. You have your acrosomic cap, or the head of the sperm, and that has enzymes to burrow through the layers of the egg or the ovum. Midpiece or body, and then there's a tail. And if you look at the ovum, has 2 distinct layers. The outer layer is your corona radiata, and that's why your sperm need to have enzymes to break through that corona radiata, and those enzymes are located in the acrosome or the head of the sperm. And then once the sperm burrows its way chemically into the second layer, which is the zona pellucida, the second layer will then change its conformation chemically, and then change its composition, and then will close out. So in theory, 23 chromosomes from daddy, sperm, 23 chromosomes from mommy, single ovum, and that will make what? An embryo, fetus, and then fetus to a newborn. Okay. Male reproductive system. Male reproductive system, of course, contains testicles that house the testes in a sac called the sac called the scrotum. It's right here. Okay, male penis, of course. This sac, or the scrotum, is connected to your dartus muscle and your cremaster muscle, which these are smooth muscles that will raise up the scrotum and its contents when the scrotum senses that its environment is too cold. Or if the environment's too hot, the dartus and cremaster muscle will relax, and then the scrotum will lower down so it kind of cools itself off. Now, the purpose of this, why it goes up why the scrotum goes up and down is because your testes have an optimal operational temperature, which is about close to about a degree lower than your body temperature. So if you're too hot, it should lower it. And if you're too cold, it should raise it towards your core body temperature, which is here in your torso. Tunica albuginea, you see this white covering, and it's of course fibrous, so it's on the outside. It's a protective layer. It divides up the testes into these lanes right here, and within those lanes there are these tubules or tubes in there, and those are called seminiferous tubules. That's where spermatogenesis occurs, here in the testes, in the seminiferous tubules. Then it will get into the epididymis, which is right here, and that's the area right after the testes, and that's the area of maturation of sperm, which is right here, colored at this artificially colored blue area right here. After they leave, it goes, whoops. After they leave, the now mature sperm from the epididymis now go to these two tubes here. There's one here, another here, and that is your ductus deferens, also known as your vas deferens, and that's the tube that gets cut in the procedure called the vasectomy. Head, middle piece, tail, we already talked about. And we talked about the epididymis, but let's now talk about all these other glands and what do they do. So your seminal gland or seminal vesicle, right here is your urinary bladder, here is your prostate gland in the male patient only. And the function of the seminal vesicle and the prostate right here is, well, the seminal vesicle first. It provides fructose or a monosaccharide used, it can be metabolized by sperm to make glucose, to make ATP, so that the sperm can, move up the vaginal canal. Prostaglandins are also located in this fluid, which stimulate smooth muscle for not only contraction, but also to kind of open up the female cervix so that the sperm will pass through. Fibrinogen, semen, clot, and vagina, nice to know. Slightly alkaline. So this seminal fluid coming from your prostate and your seminal vesicles, they come out just a little bit alkaline or basic, and it makes sense because the vaginal canal is a little bit on the acidic side. Okay. Plasmin, protein, nice to know. But remember, again, the main part of this thing right here is your prostate gland. It increases also the volume of fluid, hence the term seminal fluid, because your sperm needs to swim in some sort of aqueous or water-like environment, and the prostate gland, along with your seminal vesicle, can also help with that. Now, Cowper's glands. They're located here, like these tiny ones right here. And what is their function? Alkaline mucus buffered acidic environments, and also lubricates the gland's penis, which is the head of the penis. And the Cowper's glands are right here. They're at the base of the penis. Now, a seminal fluid is different from the ejaculate. The ejaculate is the sperm, right? That comes in the end, and it can be anywhere from 20 to 100 million of them. And on average, anywhere from 2 to 5 cc's or 2 to 5 milliliters. Now, the seminal fluid provides that aqueous environment so that the sperm can swim. It also has enzymes in it to dissolve some of the mucus in the vagina, and those enzymes are proteases, because the mucus products are protein products. And then, yeah, this enzyme, semen clot, nice to know. But I don't, not high, too high on my radar for a high valued topic. The penis, of course, you have the shaft here, and then, of course, the glans penis, which is the head of the penis. The glans, of course, is very, very sensitive. The body or shaft contains erectile tissue. Now, what does this mean? It means that your blood pressure has to drop a little bit so that there'll be increased blood flow through this erectile tissue, and that's what gives the male patient the erection. It's not a bone or a cartilage. It is a whole bunch of arteries and veins that are inside the shaft uh, of this penis here, and that's what makes it erect. You have the prepuce, which is this is of course uncircumcised male, and that has a fold over skin over your glans penis, which when removed, that procedure is called a circumcision. Gonadotropin releasing hormone, that makes sense. It's going to release FSH and LH. And I just talked about FSH and LH being involved in ovulation in the female anatomy and physiology. But in males, FSH, follicle stimulating hormone, also it triggers spermatogenesis in your testes. Sexual maturity here, LH, but FSH and LH, they're better known for signaling ovulation in your female patient than, its male counterpart items. Sex hormones, gametes, oogenesis is the creation of eggs or ovum. Now, let's go through female anatomy. Excuse me. So here are your ovaries. There are two of them. And then connected to your ovaries are your fallopian tubes. You'll see a funnel-like thing here, and that's called your infundibulum. And within the infundibulum, there's going to be finger-like projections called fimbriae, which kind of help the release of the egg from the ovaries up into the fallopian tubes and into the um, uh, uterus, which is pictured right here. Here's another view of the uterus in the pelvic cavity here. And you can see when baby grows, baby's going to grow into this nice and hopefully wide room here. That is the prepuce of the female prepuce. Now you'll notice they'll have similar names because in in physiologic development of gonads, before week 6, 7, and 8, male and female fetuses weren't exposed to the sex hormones yet. But around that time, the hormones will then build into different things. So if you have XX chromosome, your hormones, your chemical messengers will be more towards estrogen and progesterone. And if you're XY chromosome, you'll of course move towards the male, and that's with the testosterone and dihydrogen testosterone. So you'll see some parts that are similar. And those parts that are similar, like the prepuce of the female, this hood here, and the prepuce of the male, which is also known as the foreskin, it kind of matches up to here. You have like glans penis here at the tip of the female clitoris, and of course, erectile tissue here at the shaft of the clitoris, just like the shaft of the penis. And those are called homologs. The homolog to the male penis will be the female clitoris. The homolog for the male testes will be the female ovaries. Now, the vaginal canal, and this is the vaginal introitus here, the opening, and here's also the urinary um, um, uh, meatus, which is the urinary opening. So here is where you would put the catheter for your indwelling catheter. And here's the vaginal canal. So vaginal suppository goes here, not this hole here. And we already now know that the vaginal canal is slightly acidic because it has to keep out foreign body, but it becomes problematic for the sperm. You could see how the introitus is semi-open to the rest of the world. Also, the female anus is right here. The perineum is not that far away for E. coli to go from here to here. And then that'll be an issue. So whoever built us, or built you, ladies, built with two security doors. One, your labia minora, and then the larger folds, which is your labia majora or mayora. Vestibule is that area that comprises of the vaginal orifice or meatus and your urinary orifice or meatus. So in the male patient, urine and sperm go in through the urethra, but the urethral meatus is only here, and sexual function is kind of separated from urinary function a little bit in the female anatomy. So let me bring it back to this term. So the term vagina is not really the opening, it's the tube or the muscular tube that follows that. And that's the vaginal introitus or the vaginal opening. This area is the vestibule. And the perineum, here's the vaginal introitus or opening, and the anal sphincters and anus is here. So you could see very close proximity of the anus to the vaginal orifice or opening right here, and that causes a greater predisposition for urinary tract infection for your female patient. Ovarian cycle, also known as your menstrual cycle, it is a 28-day academic cycle. I know that people have different days depending on different months, depending on emotion, on what medication you're on, a whole bunch of things. But your menstrual cycle for academic purposes is a 28-day cycle. Now, this is a nice um, uh, thing, but kindly look, Google menstrual cycle or ovarian cycles, and it's a better way to look at a chart than words. So you have the follicular phase and luteal phase. So the first half of this 28-day cycle is your follicular phase. That means it's building up the follicle, and that's what this thing is. This is a mature Graafian follicle with a little egg or ovum inside it. And that is what has to develop. Sorry. That's what has to develop in the follicular phase. The luteal phase is the recycling of all the egg's products if the egg doesn't get used. And of course, ovulation is around day 14 of a 28-day cycle, and you're going to have a surge of FSH and LH around day 13. The follicular phase is dominated by estrogen, and the luteal phase is dominated by progesterone. All right, play back these last couple of minutes because they're kind of important for future examination. Infundibulum, we already talked about the fimbriae. So the infundibulum is this funnel. The fimbriae, if you could see these little finger-like projections out of here. Okay, and its function is to move eggs or an oocyte from here, then goes down the middle of the fallopian tube, and hopefully there might be some sperm there to get fertilized there. But when will they really reside? They'll really reside in the corpus or body of the uterus, which is here. And here's the vaginal canal here. Okay. Sorry about that. Had a little bit technical difficulty. Let's go back a little bit. Okay, you got that part. Of course, part of your female reproductive system, of course, is the mammary glands. And you could see there's glands with these ducts and leads to the nipple, which is the delivery vehicle of milk towards baby. So you have lactiferous ducts and mammary glands, and it's all surrounded by fat tissue. And that's why you get ductal carcinoma if you have breast cancer, because there could be cancer within these ducts or even cancer within these mammary glands. But your mammary glands or breast tissue have the capability of making milk for the neonate. First time you ever have your menstrual cycle, that's called menarche. And when it starts phasing out, that's called menopause, also known as climacteric. What two of these? Menstrual cycle, menstruation. We don't need to talk about those. We know that. Oh, this picture right here is really great. No, they can't make it bigger, but look for, so you could see 28-day cycle. In the middle is ovulation. See this pink line? So that's day 14. First part, follicular phase. Second part, luteal phase. So first part, it's when the ovum is growing. The second part is when the ovum is either used or spent, and then it recycles the rest of the products. Day 1 through 5 in a 28-day cycle is your menstrual phase. Day 6 through 13 is your proliferative phase, and day 15 to 28 is your secretory phase. So these are different phases other than follicular and luteal. And estrogen happens where? First half, progesterone, second half. And day 1 through 5, sloughing off of your endometrium, and that's when you have your menstrual bleed. Then the proliferative phase starts to grow. Secretory phase starts to grow even more. And then if there's no implantation or if there's no sperm that met with an egg, then what will happen? Then hormones will drop and it'll signal for the cycle to start over again. But if you're pregnant, the progesterone levels will be maintained by the placenta. And then you'll keep going. You won't have menstrual bleed. You'll miss your period. And that's kind of one of the first signs and symptoms that you could be potentially pregnant. Sexual intercourse is known as coitus or copulation. And the erection of the erectile tissue in both the clitoris and the male penis requires parasympathetic nervous system innervation, which means that your blood pressure should be what? Decreased. You should be relaxed. If you're tensed out, you can't have an erection. But what is also required? The ejaculation phase of sexual coitus or copulation requires the sympathetic nervous system, which is, fight or flight, increased heart rate, that kind of thing. So arousal, emission, these terms there. And remember, the arousal, the erection requires parasympathetic nervous stimulation, which is what? Decreased blood pressure, decreased heart rate. One should be relaxed in the arousal phase. But the emission phase or the emission phase is semen or the seminal fluid going through. But the ejaculation is contraction of not only skeletal muscle, smooth muscle as well, to reach orgasm. And that requires sympathetic nervous system innervation. Okay, and impotence or the inability to achieve and maintain erection is called ED or erectile dysfunction. impotence is kind of like an old term, and it's I don't know. They use erectile dysfunction as a little bit nicer term than impotence. Arousal, orgasm, we already mentioned that. What happens after menopause? Of course, a whole bunch of things decrease because do you need estrogen and progesterone in your life anymore? Nope, because you either had your children or don't want to have your children. All female reproductive structures are going to get smaller because don't need it. And it's linked to osteoporosis because remember we talked about the mammary glands? Mammary glands make milk. So mommies are used to genetics, not genetics, used to hormones telling, use up all the calcium. So you start pouring out calcium or you start leaking out calcium, that's called osteoporosis. And of course, menopause itself has a whole bunch of array of signs and symptoms because you are removing a whole bunch of hormones that have been present in your female patient's life for quite some time. Male climacteric is also known as low T or low testosterone levels. Just to know. Here's some inflammation, infection, and yeah, we're anatomy physiology. The pathologies aren't as important to us. Tumors, oh, that's extra nasty right there. And you can see how it's spread here to the axillary area. That's why you also have to check your lymph nodes here in the axillary area as well. And that concludes our lecture for um, reproductive system. Close this out. All right, and I'll see you guys in class.